Hi and welcome to UroChannel. Did you know that testosterone supplementation needs a long time to take effect? Then this video might be something for you, because I'm telling you what to expect and when. My name is Stefan Buntrock. I'm a urologist and sexologist. Testosterone deficiency in terms of late onset hypogonadism is fairly common in my practice. We are talking middle-aged men here who become symptomatic due to dropping testosterone levels. Symptoms include a decline in general well-being, depressive mood, sleep problems, decrease in beard growth, decreased morning erections, decreased sexual desire, and many more. In these men, testosterone supplementation makes sense. I also noticed from some of your comments and the questions from my patients that there is a need for information not only on how testosterone works, but also how long it takes and what to expect. Many men think of it as some kind of magical potion with instant effects, but that's very far away from reality. Actually, it takes quite a while for the first benefits to appear. Sexual parameters improve first. In hypogonadal men, which are those suffering from symptoms of testosterone deficiency, nothing happens for 3 weeks after they started supplementation. After this period, the first effects can be observed in sexual desire, sexual thoughts, overall sexual satisfaction, sexual activity, morning erections, frequency of erections, and erectile function. After 6 weeks, sexual desire, sexual thoughts, and morning erections reach their maximum. It takes about 3 months for overall satisfaction to reach its maximum and 8 months for weekly erections to reach a maximum. Erectile function almost takes a year to fully recover. In my last video about the role of testosterone for erections, it was asked whether testosterone could be used as an on-demand treatment for short-term amelioration of erectile dysfunction, like for the weekend. Now you know the answer. Testosterone is nothing for short-term results, but testosterone not only affects sexual function, but also general parameters for physical function, such as muscle strength, physical ability, fat-free body mass, bone density, hip-waist ratio. Here we are not talking weeks, we are talking months. As a rule, it takes 3 months for most parameters to see any measurable change. Bone density is an exception. The first changes can be observed after 6 months, and it takes over 3 years until a maximum is reached. For efficacy concerning waist-hip ratio, one has to wait 2.5 years, and for waist circumference and fat mass, it takes roughly 2 years until they have decreased to a minimum. Of course, this only applies to testosterone replacement therapy in hypogonadal men. But I think it shows how much time one has to give hormones for them to become effective. Don't forget to subscribe. Thanks for watching. Bye bye.